Okay. Well, why don't we go ahead and start? I'm not sure if everybody is aware that due to personal reasons, our chairperson has stepped down and will not be with us any longer. But I do want to take a moment and just appreciate the amazing work she has done for the exchange, especially in those first couple years when she worked with the organizing committees to get this off the road. Can you hear me?
We can.
Oh, good. So I am sorry that she's gone, but oh my goodness, I think she was probably here for a good part of 3.5 years. Yeah, she contributed, and indeed, she was incredibly intelligent and brilliant when it came to numbers, and really had an amazing amount of compassion that every Nevadan get the access to health care, and we are ever so grateful for the time she was with us. So that being the case, currently we're without a chairperson, and as vice chair, I'll go ahead and start the meeting. Is that okay with you, Bruce?
Yes, Dr. Jameson, that'd be fine.
Start with the roll.
Thank you. I'll call the roll. Dr. Jameson? I'm going to mark you as present because I know you're here. Ms. Lewis? Ms. Wilson?
Here.
Dr. Grinstein?
Present.
Ms. Clark?
Present.
And our ex officio members, Ms. Aiello?
Present.
Mr. King?
Here.
And Ms. Nielsen?
Here.
We have a quorum, Madam Vice Chair.
Why don't we go ahead and start in the north?
Is there any public comment here in the north? There is none.
Oh, no.
Oh,
Okay, then
I
we'll
take
go
it back.
ahead.
I take it back. There is one.
That's go ahead.
We have one. Thank you. Please be sure to push the button to be heard.
Can you hear me? Okay. This is addressing additional comments that have already been presented to the board. My name is Julianne Utley, and I'm an insurance broker. I run a small agency, and we work with both employer groups as well as individuals and their families. As a matter of fact, for the past several years, our book of business has continually transitioned to more of the individual family market because there is such a big need to service this segment of our community. To some, it would appear that licensed insurance professionals simply sell insurance. However, there is nothing simple about what we do. We begin our job by asking questions so that we can really get to know our clients' specific needs. Although the task I perform on a daily basis don't really change, the needs of those I serve does, and it's my job to properly advise them, to show them all possible options, and to help them make the best decision possible for their specific needs. Often the least expensive option, i.e. a bronze plan, isn't the best plan for them. It might be the least expensive option when you consider the monthly premium, but there is so much more to consider than just the monthly premium. Each person's specific needs, i.e. do they see a specialist on a regular basis? What prescriptions are they taking? Those are all things that should be considered to help them make the best, should be determined. I just got lost on what I was saying here. Should determine the best plan for them, and as a licensed insurance professional, I have the privilege and the duty of making sure they find a plan that will cover their specific needs and that they can hopefully afford. Additionally, we provide services to our clients throughout the year and at no additional cost to them. We build a relationship with our clients, and we encourage them to call on us should they have errors with their billing statements, have questions about their coverage, or need help with how their claims are processed. I have worked in this industry since November of 1990, and if I had the time, I could share with you numerous accounts where we helped our clients get things fixed or paid correctly, again, at no additional cost to them. If I'm performing my job correctly, our clients will get the coverage they need at the best possible price. They will know they have an advocate working on their behalf. However, if I don't perform my job correctly, they have the option of moving to another broker and in effect firing me. So yes, I do sell insurance, and I do so as a way of making a living for myself, my family, and my staff. However, I have to perform to do what is right and best for my clients, or I will lose them. I have a group client, a nonprofit company, who has served our community in the past 2 years in the capacity of a navigator, and I have found them to be an invaluable resource. There are people in our community that they can reach and service that I just can't. Conversely, there are people in our community that need the expertise of a licensed insurance professional and the advice that I can provide them, and this is a service that they can't perform. We called on them numerous times for assistance, and they referred people to us when they felt we could provide better services to the community. There is a need for both entities if we are going to properly help people get the coverage that they need and want. I would like to end by thanking the Silver State Health Insurance Exchange for working with all 3 of the professional associations of licensed insurance professionals to collaborate on ways to utilize both navigators and agent brokers for the upcoming open enrollment, so that everyone in the communities that we serve receives the assistance they need in order to obtain the best coverage possible. Thank you.
Thank you very much. Would it be possible for you to share a written copy of your remarks with Ms. Cox of our staff? Thank you. Is there any other public comment here in Carson City? There's none.
Thank you.
Madam Vice Chair.
We do have public comment here in Las Vegas. Go ahead and introduce yourself and make your comments. Thank you.
Good afternoon. My name is Lydia Bosky-Heater, and I'm the state president for the Nevada Association of Health Underwriters. On behalf of the licensed insurance professionals in the state of Nevada, we would like to publicly applaud the Silver State Health Insurance Exchange for their decision to work with the 3 professional associations, the National Association of Health Underwriters, the National Association of Insurance and Financial Advisors, and the Nevada Independent Insurance Agents on the upcoming open enrollment. Excuse me. We believe that this partnership with the exchange and the navigators will benefit not only the consumers who are underserved and hard to reach, but all consumers who are in need of assistance in selecting the most appropriate level of coverage when purchasing their health insurance. As we embark on this next open enrollment, insurance professionals throughout the state will be partnering and attending the Nevada Health Link events. With all of the strategic support and advertising from Penna Powers, the outreach from the Ramirez Group, and the navigators, we expect that this will be the most successful open enrollment Nevada has had to date. Our purpose and main objective is to provide the same level of consumer support in education, advice, and service that we give to all of our clients, whether you're insured through an employer purchasing an individual health plan or eligible for a subsidy through the exchange. We feel that consumers in the underserved communities deserve the same professional guidance as all consumers have. We found that throughout the past 2 years of the Affordable Care Act, that the least expensive policy doesn't always equate to the best level of coverage for an individual. A survey by Avalier found that in 2015, there were over 2 million people nationwide qualified for a cost share reduction subsidy, but purchased a plan in the meta levels that do not offer the cost share reductions. Cost share reductions lower a consumer's deductible, coinsurance, co-payments, and out-of-pocket maximums, but are only available to those who qualify for the purchase of the silver level plan. The survey indicates that the consumers shop for plans based upon premiums, and an estimated those 2 million consumers purchase bronze level plans. By being in the most appropriate plan and taking advantage of the premium tax credit and the cost share reduction when they qualify, consumers achieve the goal of the ACA, to have appropriate insurance coverage and have it affordable. Licensed insurance professionals guide consumers through the process while ensuring that they get the best policy at the most affordable price. The licensed professional will take the time to understand the consumer's requirements and recommend the plan that best complements their financial and medical security needs. We've all heard of stories from consumers over and over again who have purchased plans based upon only premium and then later feel that they have no coverage. In addition, consumers have had their struggles after they've enrolled, with issues such as eligibility verifications, claims, and billing statements. These are all services that a licensed insurance professional is able to help resolve for the consumer as their advocate throughout the life of the policy. It is easy to assume if you call the insurer's member services line that a consumer will get all of their issues resolved, but that's just not the case. Agents provide numerous services that involve research, documentation, and submission to the carriers on behalf of the covered insurer to appeal insurance company decisions. To advocate on behalf of our clients is our #1 priority. Our approach as an industry is to comply with the federal laws and to work with the exchange and the navigators in a collaborative effort to serve the citizens of Nevada. We welcome any conversations regarding concerns and in the spirit of cooperation, hope to make the 2016 open enrollment the best possible experience for all. The members of our 3 professional associations continue to strive for excellence in our chosen profession with initiatives that promote the betterment for all whom we serve.
Thank you so much. Is there anyone else who would like to make a public comment?
Thank you. For the record, my name is Barry Gold. I'm the Director of Government Relations for AARP Nevada. I'd like to start off my public comment by also recognizing and thanking, I guess since she stepped down, she's no longer Chair Johnstone. She was here from day one. Many of us were here from day one. She toiled long and hard from the first committees, a Consumer Assistance Committee, and wanted to make sure this was done right. So I'd like to start off by saying that. The reason why I'm really here is I want to talk about, I want to mention a letter that was submitted by Elisa Cafferata talking about a situation with the navigators and what's going on with the navigators. And in her letter, she talks about some conflicts of interest and some changes to what the navigator functions were going to be. And from your own documents, from your agenda item marketing and enrollment system, it says that navigators will be available for triage during enrollment events. And it talks about the dynamics between the exchange and the producer community is all changing, to change things. So there's a lot of things that are going on that I would like to talk about just a little bit. And you had another document that talked about the navigators assisting brokers at predetermined events, and that was in Ms. Cafferata's letter. And that's of concern because the navigators by law are supposed to provide impartial advice and all that, and I do believe they will do that, but if these broker events are predetermined as who's going to be there, which navigators, which brokers, kind of take some of that free choice away. Now, I know there was a meeting with navigators this week, and in the navigators, they were pretty much promised that, we're not saying you are not allowed to enroll people, but pretty much their job has changed, and they're not so much enrollment assisters anymore, but they are outreach coordinators. When I spoke to a lot of the navigators, several navigators, they said they were disappointed in that. They said that's not really what they signed up for. They said the grants were very specific. Again, that's not what they signed up for. And some of them hired specific people that were going to be enrolling people, not actually doing like outreach and education for that. So there's kind of a difference. Now, it seems to me that there is, I would say not preferential treatment, but there's been a policy. There's been a policy that's been decided by Nevada HealthLink to drive or push a very large majority of all signups, of all actual enrollments to the broker agency community. And there may be reasons for that, but the idea of that is, doing that increases the profit motive and the incentive for the broker agencies over the navigators. Now, I fully understand there is no additional cost to consumers. They pay nothing. They don't see any of this. They don't know the difference. But you have to consider that if the insurers, the insurance companies, if all of a sudden 90% or 95% of the enrollments for exchange members are done by brokers or agents, and the insurance companies are paying those commissions, those costs are going to come out somewhere. At some point in time down the line, they're going to come out, and it's going to be probably increased premiums. So I think this policy to push a majority of enrollments to the broker agencies is one that needs to be reconsidered. Let's go back to the beginning. In the beginning, in day one, when Leslie Johnstone, and I see a couple people in this room and up north that were involved in all these meetings and sat here, there was a lot of discussion on who was going to do what and what was going to happen. And what I will say, without hesitation, is there were some people that were talking about whether navigators should even exist, whether they were qualified to do what they did. Do we even need to have them? Why are we going to do this? It should only be brokers. Well, fortunately, unfortunately, the Affordable Care Act requires there be navigators to be there. So the navigators are a part of the law, and they're there, and they've been doing their job very well. I sat, it was either at this table or another table, and I talked about the training and the level of expertise that they had, and the training that the navigators receive are equal to or more than what brokers have to sell insurance policies, QHPs, through the exchange. So that is not an issue. So I think this change is looking at a couple of different things. Now, one of the problems with this change is it opens it up a lot more people that are buying programs. It opens it up the idea for cross-selling process. In other words, generating referrals for other businesses. So if only brokers or mostly brokers are selling policies, oh, by the way, I also sell car insurance. Oh, by the way, I sell life insurance, and you may or may not need that. And when people are coming to Nevada Health Link, or they're going to the events, they're there to buy health insurance and health insurance alone. So there's a potential conflict there. I'm not saying anybody would do that, but in the beginning when they talked about there only being brokers and agents, that was squashed. And the navigators were there to kind of do that balance. As I mentioned, it seems like there's been preferential treatment. No, I'll take preferential treatment back. There's been policy that's decided that a majority of the actual enrollment will be done by brokers and agents, not by navigators. A question that I have is there's a function on the website to look up where to get help. And I kind of asked this question, but I didn't get an answer. Will the navigators even be listed on that, or will only brokers and agents be there? You know, when I read language that the navigators will go to these predetermined events, whether they're the sign-up Saturdays or the pop-up events or whatever we're calling them, and they're there to triage clients but not actually sign them up. I heard it described earlier, there's a partnership between brokers and agents and navigators. It's not a partnership. The navigators are the stepchildren. They are on the back burner. They are not good enough, let's say, to actually sign people up. I can say whether you're eligible, I can say whether you're on Medicaid, but when it's time to actually look at the products and sign them up, we're going to send you over to somebody up. And I just think when you're looking at that, and especially this is the first year that with the new law, there's a new law in Carson City that there's somebody who has ties to the industry that is sitting on the board, and that's a great thing and it's doing a good job. But the fact that that happened, and now it seems like policy is to push a majority of the enrollment to the broker agency community, there's just something there that, let's just say, just doesn't taste right. There's just something there, and I know that a lot of the navigators I've talked to are a little uncomfortable in their new role, that while they were told this week you are indeed allowed to sign people up. No, we're not saying you can't. That's not their primary focus anymore, but that's kind of what they signed up for. So that's what I wanted to talk about.
Mr. Gold, thank you for your comments. Welcome. Yes. You need the green light.
Okay. For the record, Lou Silla, I'm a broker in Nevada. I don't sell car insurance, so Mr. Gold doesn't have to worry about that. It's regarding renewals. You know, the value of a business, in any business, especially reoccurring revenue business, retention is important. And I just recently got a lot of phone calls the last day or two from customers who have just recently gotten their renewals. And one of them was kind enough to send me the letter that they got. And I just want to quickly go over some highlights. I have all the documentation here. His annual premium after the APTC for 2015 is $85.83. His new premium, according to the letter after the APTC, is $746.52. Now, clearly, there's something wrong. Okay, he was this year he's paying $85.83, and according to the letter that he got from Health Plan of Nevada, next year he'll be paying $746.62. And again, I'm sure it's a mistake. Okay, and I'm going to work on it and get it corrected. But the issue is, from a retention standpoint, this is what the customer got. And the very first thing he said to me on the phone was, I'm not paying this. I'm not going to renew this. So I just felt that I would bring this issue, and I just pulled one other one off my list. And I mean, there's quite a few of them. And I don't know that they're wrong or right, but this particular one is another person who, let's see, this year they're paying $243.21, and next year they're going to be paying $348.01. And it looks like the premium for 2015 is $1,087, and the renewal premium is $1,192, which is about the guidelines of the 9% increase that some email I got from the insurance company saying that's what it was. However, when you calculate the premium, they're paying now $243.21, and they're going to be paying $348.01. Well, that's not 8 or 9%. I did some quick math, and I came up with 43%. So the concept, and I mean, I have a little experience because I used to sell property and casualty, and I dealt a lot in the used car business market. And, you know, when you're dealing with people who, by nature, have restrictions on their income, some of them can't afford this. So it becomes a contradiction to the Affordable Care Act. I don't know if the board is aware of it, if the management, I mean, everybody's done a great job. I go back to the days when you couldn't get anybody enrolled, and this year, it's like walking in the park. It is absolutely phenomenal. So I have to say, everybody, kudos, a job well done. But to think that your 70,000 customers, when they get these letters, the ones that don't have a broker to call, the ones that maybe they can call their navigator or whatever, the assisters, who will be able to follow up on this stuff for them. I don't know what their procedures are or what their rules are, but you got to figure that you're going to suffer a big loss. I mean, I would suspect that your renewals by February 1st will probably be off 20 to 30%. So hopefully we can get this thing nipped in the bud and get it moving forward so that we don't have to deal with that come January. Thank you.
Thank you, Mr. Sila.
Mr. Silla, may I ask
Was
a
there-
question? May I ask a question? The letters that you're referring to, those aren't from Nevada Health Link. That's from a carrier, I assume. Is that correct?
That's from the letter that I have, sir, is from the carrier. And it
Okay.
was the insured just sent it to me.
Okay.
Took out the name. Give you a copy of
Okay.
it. And
Thank you. Thank you.
look at it. It's just, as soon as I saw it, the first thing that stuck in my head is, this is what they're looking at. And if I were to tape the 7 phone calls I got yesterday, I should say the second sentence was, I can't afford this. I'm not paying this. So, you know, when you start looking at it in that perspective, it kind of changes the picture.
Right. It's
I
a
just
good thing
wanna-
they have a broker to
Yes,
help
sir.
them then.
Absolutely. Thank you, sir.
And then for the record, there is someone who sent in a comment, and it's posted. Lisa Cafferati also made a statement regarding the similar issues. So we'll go ahead and proceed. I'd like to note that during public comment, that Ms. Lewis joined us. Thank you, Ms. Lewis. So what I'd like everybody to take a last look at those minutes from September 10th. And if there are no comments, if we could have a recommendation for approving those minutes. And do we?
Madam Chair, it's Valerie Clark. For the record, I make a motion to approve the minutes.
And did we have a second on that?
Angie Wilson on the chair. I also second that motion.
So is everyone in favor? Say aye.
Aye.
Aye. No opposition? Minutes are passed for September 10th, 2015. Our next item is possible action item number 4, election for chair, vice chair to fill vacancy or vacancies from among the membership of the board. And so eligibility are any member of the board. Appointed members are Florence Jameson, Lavon Lewis, Angie Wilson, Aaron, and I apologize, Aaron. Aaron, is that Grenstein?
It's
And
Grinstein.
Grenstein. Thank you, Grenstein. and Valerie Clark. Ex officio members are Betsy Iola, Amy Park, and James R. Wells. I would like to entertain any motions.
Madam Chair, I'd like to nominate Dr. Florence Jameson as chair of the Nevada Silver State Health Exchange Board.
I'll second that.
Do we have a second? Okay, thank you. And everyone in favor, please say aye.
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 Anyone in opposition? Thank you. Okay, next item of business, our executive director's report. Mr. Gilbert?
Madam Chair, we now have a vacancy in the vice chair
yes.
slot.
Yes, thank you for pointing that out. Yes.
We
I
could
would
allow
like
you to hold both, I assume.
Let me entertain a motion for vice chair. Thank you. I would like to nominate, cannot?
I think it would be important for one of the chair people to
Yes, I
be
agree with
in,
you.
I
I
up
agree.
in northern
Yes,
Nevada.
I agree with you. We want someone in Northern Nevada to step up here. Who would like, who is interested
Madam Chair?
in being nominated?
Madam Chair, if I may, I did canvass the membership of the board previously, and the one person who did indicate an interest specifically in the vice chairman position was Dr. Grinstein.
Well, very good. Can I hear an emotion?
Madam Chair, I'd like to nominate Dr. Grinstein for vice chair.
Angie Wilson, for the record, and I will second that motion.
Thank you. Everyone in favor? Aye.
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 Any opposition? That would be a unanimous. Congratulations, Dr. Grinstein. Now, we are so ready for that report, Mr. Gilbert. Thank you. Mr. Gilbert, if you're saying anything, we can't hear anything.
You know, that's hard to believe because I'm really very loud. Thank you, though, Madam Chair. What I was saying is...
Have you started yet?
Yeah, I just did. I just did.
Okay.
All right. As I meant to say, before I make any actual remarks, I'd like to introduce Aaron France as our, new financial officer. He was here with us last year, but as I said, he didn't get to sit at the big kids table, but he does today. And also Dawn King is here. She is our new compliance analyst and will be working with us with respect to federal and state compliance issues. We're very, very pleased to have her here as well. My report is oral rather than written. I apologize for that. Oddly enough, the month before open enrollment tends to be fairly busy, and the demands on my time get to be fairly significant. You know, open enrollment is 3 weeks away, and I've been out and about, frankly, speaking with the media, and there's just an awful lot to do. I met yesterday, I think, with the editorial board of the Reno Gazette and Journal, and it's really interesting because I've not done editorial boards before, and that's a totally unique experience. It was enjoyable, though, and I appreciate them taking the time to speak with me. But it reminded me that invariably what we will be asked over and over again over the course of the next 4 months roughly is, how many? How much? Who are you signing up? Where are they? Where are they coming from? How many, how many, how many? And I would tell the board, and you probably know this about me, I'm a really lousy prognosticator, just flat out bad at it. If you would have asked me last year how many people we would sign up, I would have told you probably about half as many as we actually did. And if you ask me this year, I'm afraid I'll tell you twice as many as we actually will. I'm just not very good at it. You know, we were I don't want to say we were lucky because it wasn't luck that led 73,000 people to sign up for insurance and enroll through the exchange. And it wasn't luck that led us to where we are today. You know, this year, this is an unusual year. Last year was unusual too because we were coming off a year where we hadn't done very well. This year, we did very well in terms of enrollment. However, there's market turmoil. 2 of our carriers are going away. Assurant has pulled out throughout the United States from exchanges. And the Nevada Co-op, of course, will not be offering coverage subsequent to December 31st. So it's going to be a market that's in transition. And of course, there are continuing political overtones, undertones, whatever you want to call them, with respect to the Affordable Care Act in Washington and, of course, in Carson City as well. So I'm sort of loath to say, here's our target, here's what we're going for, because to be frank with you, I just don't know. And I won't know until open enrollment is over. All I can tell you is, as I told you last year, we will do our absolute best. We will leverage all of our assets. We will leverage our new partnership with the brokers and agents. We will leverage, our navigators. We will do everything possible to enroll every single eligible Nevadan in health insurance. And I can't possibly give you a better answer than that. I will say I appreciate Mr. Gold's comments. I understand his concerns. I also appreciate Mr. Silla's comments as well. You know, it's interesting with respect to Mr. Silla, we don't control what carriers send. Now, that being said, as I pointed out sort of facetiously, but actually not facetiously, it's a good thing those people have a broker who knows who to call and who knows how to reach out to the carriers and how to try and resolve these situations. So I think that sort of dovetails into Mr. Gold's comments. Again, I appreciate the fact that there may be competing policies or ideas about how we best accomplish our mission. But I assure you it's not because anybody's profit-oriented. The idea is to leverage as many assets as possible to sign up as many Nevadans as possible. And it's really just that simple. You know, the truth is our enrollment facilitators and navigators do help us significantly in terms of our outreach to underserved and hard-to-reach populations. We've seen that over the course of the last 2 years. Those are facts. What we have also seen over the course of the last 2 years is that our navigators are not particularly successful at adding people to the roles. They have not been successful in terms of enrollment. Doesn't mean that they're not good people, and it doesn't mean that they don't try hard. But the fact is they have not been successful in that regard. That puts us in a position where we can say one of two things. Oh, we don't need you. That's not a good thing to say, and it would be simply wrong. Or to say, let us take advantage of and leverage your talents and abilities. Let us take advantage of and leverage your ability to outreach and perform consumer education. Let us take advantage of the fact that you are members of the community to help drive enrollment. And that's exactly what we've done. You know, I have an insurance background, and I've worked with agents and brokers for many years. They're not biased. They're not bad people. They're people who genuinely assist other people. And I think that one of the great injustices to this point in time, and I've shared this with the board before, has been the fact that we shunned them. We sent them away. We basically said, you don't belong on our board and we don't need to work with you. We have other people that we can work with. And I think that it showed in that first year. Not only did we have issues with regard to our technology, but the people who could most help us, the people who are used to and familiar with ways to assist people when they're purchasing insurance, we shunned them. We should never do that. We need to work with everyone. And that's all that we're doing at this point in time. You know, we certainly anticipate and plan on our enrollment facilitators and navigators helping people, putting a face on the Nevada Health Link, making sure the technology doesn't keep people away, and in fact, conducting the type of outreach that is necessary for us to serve the population that really needs us to assist them. Again, I very much appreciate all the comments made. I understand them. I think that we're on a better course than we were. And that would be the sum and substance of my remarks, and I'm happy to take questions.
I would like to ask if there are any questions for Mr. Gilbert on his report at this time from the board, or anyone, any other?
Madam
attendees.
Chair, Valerie Clark for the record. I just have a few questions. So in your experience, since you've been here, Mr. Gilbert, have you seen a trend of any complaints against brokers or anything that the community should be aware of or the board should be aware of in terms of activities that would need correction or anything like that?
Thank you, Ms. Clark. And for the record, Bruce Gilbert. And the answer is no. And frankly, I follow this nationwide, or attempt to. And what I've seen more often is complaints about navigators in terms of telling people to misstate income or other things, but I have not been made familiar with any issues with regard to brokers.
Thanks. And am I allowed to make a statement?
Of course.
Okay. I just want the gentleman who had who received the renewal that went up from $50 a month to $700 a month. I think that's a perfect testament to the broker community. I couldn't think of a better way to exemplify what we do. I mean, my first feeling when he made that statement was, to grab that piece of paper and let me investigate what happened there. Because clearly, to me, there is a mistake. Either he obtained employment and now is not eligible for a subsidy or something of that nature. But that is a perfect example of why people like brokers are here. And everyone knows I am a broker. So, our first inclination is to immediately want to help and get to the bottom of it and get resolution for that client. And I have a lot of friends who are navigators. I use navigators in my practice, for varying reasons, and they're typically not trained to do those type of things. And so there's a place for all of us at the table. I don't think anyone's trying to push anybody out. Clearly, the brokers did feel somewhat left out of the ACA in the beginning stages. I think as time evolved, we were seen as a valuable resource, and now I believe truly people believe that. But there's not a better testament to what we do than what this gentleman is looking at right now. So thank you for letting me say that.
Thank you so much for that comment. And Mr. Gilbert, on your report, you brought this up, and I think a lot of us were curious. Do you have handy in 2015 of the approximate 70,000 that we signed up, 2014-15, of those that were signed up, approximately how many were signed up by navigators?
Thank you, Madam Chair. Bruce Gilbert for the record. The only information that we can get in that regard is available from our enrollment stores, because there were statistics kept there. And our understanding is, based on those statistics and the information that we've been provided, is somewhere in the neighborhood of 2,000 or 3,000 and a maximum of 5,000 people were signed up by the navigator community.
And just approximately how many navigators did we have? Enrollment assisters and navigators.
Yeah, I believe we had in excess of 50, but I'm not sure off the top of my head.
And approximately how many, Valerie may be able to help with this one, brokers do we have in the community at large? I know that's a tricky question. It's like physicians, how many have an active license? How many are active brokers? And then how many, because Bruce and I talked about this when he first came on, about the fact that we had a lot of brokers that weren't yet working with us. So compared to about a year ago, or even just if all we have is a year ago numbers, or if we have a ballpark figure for today, with regard to brokers, have we improved in the number of brokers that are now working with us? Because before there was a really large number of brokers, and most of them were not working with us. So I just wonder, do we have any feeling on those numbers now? I know we have more. I know that we have a lot and to do the job out there, but do we have any concept if it's 10%? I mean, in the past, it was actually rather a small number of the majority.
Valerie Clark for the record. I don't know any numbers. I can tell you that the last time I heard a number in terms of the number of licensed brokers within the state of Nevada, it was somewhere around 7,000 or 8,000. In terms of how many actually are working with Nevada HealthLink, I do not know that number at all. I can tell you I've got 5 or 6 licensed people in my office, and only one of them is signed up to work with the exchange. because we're primarily a commercial agency.
Again, thank you, Valerie. That's helpful. And Bruce, do you know the number that we're actually signed up with us?
Madam Chair, when we have put our lists together, there have been as many as 500. What happened was the first year there were a number of brokers and agents that signed up to assist, but as a result of the frustrations created by the failure of the platform, most of them simply did not take part in the enrollment. And we scared a lot of people off with the transition to healthcare.gov because I don't think anybody was certain that that would go well. So we have a list of people, but how many of those people were active, I think, is an open issue. I believe that what we're looking at, though, is several hundreds of brokers who will be working with us on a going forward basis through the professional associations, and they'll be essentially in every neighborhood in the state of Nevada.
And Mr. Gilbert, I've often been accused of micromanaging, and I wouldn't even want to go there. But I would like to ask you to something kind of tying the two things together that were your main topics in your report. The volume that we signed up in the last period, 73,000. And although I kind of, when you were talking about numbers, and yes, every time we ask you for numbers, you never do commit. I agree. And it's because it could be really low or really high and always off. And as an obstetrician, always guessing weights, we're either a pound less or a pound too much. We're never there. But I'm going to say, as you all recall, we had guessed getting well over 100,000 the first year, 116,000 on the first year sign up. And Mr. Gilbert, you have got our process. I'm sure it's not as fine-tuned as you'll have it, but they say excellence, just comes out of habit and a good process, and you've really done a good job. I'm going to project with this, and if we can get more brokers and, continued, after all, navigators aren't prohibited from signing up, but continue getting everybody's involvement. I'm going to say that we're going to shoot for breaking 100,000 this year. And, Mr. Gilbert, one thing that I would like to, you to own on this project, along with everything else, is to maybe what we sometimes do when some people leave the flock is we reach back out to them. And maybe if you still have the list of some of the discouraged people, originally they must have been very passionate about wanting to participate in the project. And now that they've seen the success of our organization, possibly you could reach back to some of them and ask them if they're interested in participating again. Because the numbers we have involved right now, I think we would like them to go up.
Did you say something after 100,000, Madam Chair?
Yes, my husband tells me I'm very soft-spoken.
I thought I heard that number. And the truth is, yes, we do have a list of every broker who has ever signed up with us, and we're more than capable of reaching out to them, and we will certainly do that.
And just one last question regarding navigators and brokers that we often talked about in the past and was something that was going to be answered and kind of gotten back to us a year or so ago, but I don't remember hearing. I a vague answer. Someone said they thought it was like 3 months. In the long run, the navigator, in the short run, enroll them, but then the plan was that once that person was enrolled by the navigator, that at one point they should be, directed to an actual broker. And there was a sort of a time frame and a process for that. And I really don't, that's also foggy to me now. Could you kind of refresh that for me? Because would wrap up this whole situation, I think, for now.
Thank you, Madam Chair. Bruce Gilbert, for the record. I'm sorry, I do not have recollection of that. It may have been before I came in August. I know that we have always, since my arrival, talked about trying to find a way so that there's harmony between the broker and navigator communities. But I don't know that there was any specific discussion about how long somebody should be with a navigator as opposed to dealing with a broker.
Valerie Clark, for the record. Until I saw that public comment that was slated for today, I was not aware of any issues between navigators and brokers. I thought everyone was quite clear on their roles. And because navigators don't get paid, the way brokers get paid. I never suspected that there was ever any issues. Anyway, but that being said, my other comment was the bricks and mortar discussion that we had at the last board meeting, that we weren't going to do that anymore because it was too costly. I've heard more brokers get very excited about that because now they can actually put together their own programs. I know the one person in my office that does it, we're planning Saturday meetings. We've got a whole lot of stuff planned because we can do it in our office now. We can advertise it to be in our office. We've got our own brick and mortar, and I sense buzz about this open enrollment within the broker community than I certainly have in the past. So for the record, thanks.
Thank you so much. Gee, I may have underestimated.
Madam Chair, if I may.
Yes, please.
Erin Grinstein for the record. I just wanted to address. Is lower?
No.
Are you good?
Yeah, you're good.
Okay. I just wanted to address the issue of navigators for a minute. I have some experience working with navigators in different types of settings related to healthcare access. And I know this is a little bit different, but I just wanted to voice support for the fact that navigators are traditionally used to link community members with services. And so in this capacity, it doesn't seem strange to me to have the navigators working, doing education and outreach within their communities and linking them to the services of insurance agents or brokers, which is not to say that they couldn't do the enrollment themselves if that worked, but having them do the education and outreach is traditionally the role of the navigator, and roles that navigators have been extremely successful in within health services research, at least.
And I would also like to, Angie Wilson for the record, like to also make a comment. And I sit on the board with coming to this meeting, just chairing the Nevada Tribal Health Directors meeting. And also will say, for the record, a comment that I have is in regards to the Nevada tribes as a whole. We've looked at navigators to do the exact same thing, outreach and education specifically. In our particular tribal programs, we offer an entire range of services. We do not use and go through the brokers per se. We really count on the navigators and do that quite a bit to do outreach and education on the provisions of the Affordable Care Act specific to American Indians and Alaska Natives. And so I do feel the same as several of the other board members have said, that I believe that there is a role for navigators, and I feel like that role of outreach and education certainly has been a blessing to the Nevada tribes and will continue to use them that way. I mean, there's a vested interest in that for sure. The thing that I would also comment on is, I'm a little bit more hesitant to feel comfortable projecting any numbers for what the enrollment will be this next year, because I think for my particular population, there's additional issues internally in our tribes of what we are allowed or not allowed to be able to do premiums in regards to our particular tribal population. In Clark County alone, just today we talked about having 30,000 American Indians in that particular county on their own, that we're still trying to figure out how to get out and network in regards to Medicaid enrollment. I don't feel comfortable with the comments on projecting a particular amount of people, even as a projection from the board in my role here, because I do think that as we continue to work forward, supporting the initiatives of the Silver State Health Insurance Exchange, certainly the Affordable Care Act has been a significant blessing to American Indians with the specific provisions, but there are additional issues that will prohibit some of our enrollment that have nothing to do with the board or the exchange and have to do with how our operations are running internally, what's cost effective in the way that we provide services and pay for those services for our tribal members. So I just feel like I want to make sure that I make that statement for the record.
Thank you so much. And actually, this segues right into our next, which is the Navigator update.
Madam Chair, I believe Mr. King wanted to make a statement, if he may.
It's Cliff King, Division of Insurance. And there's a difference in licensure between a navigator, which is licensed as an EEF, Exchange Enrollment Facilitator, a person who assists people in enrolling but cannot give any advice or direction. They can answer questions but cannot give any advice. And a licensed producer, totally different license. A person cannot be licensed as both at the same time. In order to become an EEF, they have to surrender their producer license. And a producer can be either an agent who represents a carrier or a broker who represents independently the consumer. And so there's a vast difference between what the functions are of the two, but hand in hand, they work together. And the reason being, the producer, agent or broker, can make recommendations. The exchange enrollment facilitator or navigator can then help enroll the person in the particular program. Now, at the Division of Insurance, we do have a consumer section that does receive complaints over the particular plans that they have. And quite often, there is some guidance needed. For example, people chose the wrong plan because they went by price, not by the pharmaceutical choices. If you take a look at the Division of Insurance website, we have every plan available in the marketplace, whether on the exchange or off the exchange. It has the list of providers, the provider directory for each and every plan, as well as a formulary for each and every plan. So there's a lot of information there available, but sometimes people need a little guidance too. So they each perform a separate function.
Thank you so much. Were there any other statements on this or questions? Then, Mr. Gilbert, then I think we can go on to the next topic of Navigator update.
Thank you, Madam Chair, and I believe Rosa will handle that down there in Las Vegas.
Rosa Alejandre for the record. I'll be giving the Navigator program update. And just to let you know, I'm the Navigator program manager. The purpose of this report is to provide information to the board and public on the Navigator program update. All Navigator entities have been working on outreach and education. Since May, thus far, they have participated in over 60 outreach events collectively. All Navigators hired before October 1st, 2015 are CMS certified for the 2016 plan year already. Navigator agencies will be ramping up to their fully allocated exchange enrollment facilitators, EEFs, during October to prepare for the November 1st open enrollment period. Navigators hired during this period will go through all the training and certifications required prior to assisting any Nevadan. Navigators will be prioritizing outreach and education to underserved and hard-to-reach populations during open enrollment while assisting brokers during special events that have been predetermined by the exchange. Navigators will also work collectively with our marketing and outreach events by Penna Powers. That concludes my summary report, and I'll be happy to answer any questions if you have any.
Do we have any questions for Rosa?
Yvonne Lewis for the record, and perhaps I just wasn't listening carefully, but how many navigators do we have?
At this moment, we have approximately, because we're still in the non-open enrollment cycle, 25. We will be ramping up in the south. We will be ramping up to approximately 40 to 42 navigators. In the north, we will have approximately, right now we have in the north, just so I can make sure, 10 that we have in the north, and we will be ramping them up. Well, actually, we're already full for the north. Okay. And I am going off of the 75-25 we had given previously.
Were there any other questions for Rosa on the navigators? Thank you, Rosa. So at this time, we would like to have our marketing and open enrollment update.
This is Angie Wilson for the record. Rosa, I have one quick question, just so that I'm aware and I can advise the tribes afterwards. When the open enrollment period for Nevadans is closed and it shifts over to, the tribes still being able to be enrolled through the year, how many navigators in the South and North are retained after the open enrollment is over?
For the record, Rosa Alejandre, at this moment, we will go back to our non-open enrollment period, and I imagine we will continue with the same numbers. Our grant period ends on the 31st of January. So right now, I can only give you the numbers that we'll have for open enrollment cycle, because that's what our grant will go to.
Okay,
But for non-open enrollment previously, this year we had 21 in the South, and in the North, we're ranging between 8 to 15.
Thank you.
You're welcome.
For the record, Janelle Davis, Communications Officer for the Silver State Health Insurance Exchange, and I will be giving the marketing and open enrollment update. As we know, open enrollment starts November 1st and goes through January 31st, 2016. This is the third open enrollment that the exchange has initiated. Our kickoff event will be held on Sunday, November 1st, 2015 from 10 a.m. to 6 p.m. at the CSN Charleston campus, Building D in Southern Nevada. And for Northern Nevada, it will be held at the Reno Boys and Girls Club. The closeout event held on Sunday, January 31st, 2016 will be from 10 a.m. to 6 p.m. at the Clark County Government Center and again at the Reno Boys and Girls Club. In addition, we've talked about these co-branding events and with the broker community that we are working on. We are going to hold up sign-up Saturday events, midweek pop-up events, which is actually Tuesday and Thursdays, and a December and January 15th event. Like we said, working closely with the broker and agent community in order to provide in-person assistance, and navigators will also be available for triage during the enrollment events. And disregard that I would like to introduce, because Lydia actually already spoke during public comment about how we are working together. Our advertising campaign will begin October 26, 2015. Our marketing firm, Penna Powers, will be presenting a detailed media plan for you and a calendar to showcase the campaign. We are also working with the Division of Insurance for the month of October, as it is Healthcare Awareness Month, to attend events and distribute literature for outreach opportunities and to provide the public with open enrollment information. The exchange has spoken to the governor's office and will also be working with them to produce an informational video, and that should come out via our social media channels, YouTube, and other advertising outlets within the community during open enrollment time. Our call to action for the campaign will be available via our website on an easily accessible link within our homepage. A broker agent listing by location and language will also be available for the consumer in order to look up events and licensed enrollment professionals in their specific neighborhood. The exchange will also be releasing calendar advisories before each event in order to alert the public of in-person assistance and upcoming events. And at this point in time, I'd like to turn it over to Patty Hallebuck, who is our Nevada Accounts Manager for Penna Powers, and Andres Ramirez with the Ramirez Group to discuss outreach and our kickoff event.
Thank you, Janelle. Good afternoon, everyone. For the record, Patty Hallebuck with Penna Powers. You should have received a marketing update for the month of October, and I'd like to walk you through that. I wanted to let you know that the objective for this particular marketing update is to provide you with the big picture overview of what our marketing efforts intend to be throughout the enrollment period, which is November 1st through January 31st. Moving forward, in subsequent updates, we'll be able to show more of the creative elements, track performance, discuss benchmarks, milestones, etc. So the first piece of our marketing update is a flow chart that, again, gives you this big picture of the marketing scope and the tactics that we'll use. As we move forward with additional slides, I have more detail that I can drill down, so I'm not going to go over this in depth. But specifically, what I wanted to point out with what we have been talking about is a key component is the broker agent marketing. And again, we are making big marketing efforts to support that key piece of the plan this year. And also, as everybody knows and continues to be, outreach is a huge part of our marketing campaign, and again, will be this year. And Andres is here and we'll elaborate on that as we move forward. What you have on the next 3 pages is an in-depth calendar of events and opportunities and messaging that will take place throughout the marketing campaign. As Janelle mentioned, the campaign, our advertising campaign, kicks off on Sunday, October 25th, which is a week before enrollment. And you can see on the calendar that we list out all the various media activities that will be taking place and what the messaging and the opportunities are associated with each. I'm not going to go through this in depth. There's a lot of information here that you can drill down, so I just want to go through a few highlights for you. One thing being the general messaging throughout the campaign obviously is going to be awareness that it's enrollment time. Throughout the campaign, we'll also have times where we focus additionally on key messages. For example, this first week in October that we run, we will have some layering of messages about the kickoff events themselves. In addition, we will support with messaging throughout the campaign for various broker activities that Janelle alluded to, such as the sign-up Saturdays, what we're calling the pop-up events or Tuesday and Thursday events, and then some of our 15th of the month events in January and December as well. In the month of December, one of the key layered events that we'll focus on is the December 15th event. And this will be basically the last day of the month that consumers can sign up to entertain coverage that would begin on January 1st. So that is another key milestone that we want to play up. And then in January, we have 2 other key layered events, one being the January 15th monthly event, and then certainly our closeout event. Also in January, I'd like to point out that the messaging for the overall campaign will take more of a tone of a countdown. Being the last month of enrollment, we want to start to stress that there's more of a sense of urgency, that there's only a few weeks to enroll. So it'll take down a bit of a countdown kind of flavor, if you will. And in the next pages is sort of the drill down to the tactics that I had mentioned earlier. So I'd like to go over a few of these with you. So starting off with media, we conducted lots of research and meetings with various station partners, both in the North and the South. And what you'll see here are the partners that we decided to align with. We felt that after these meetings and this research, they offered the best combination of product, inventory, and opportunity to create enrollment awareness and ultimately help drive sign-up. So in the Las Vegas area, we intend to partner with Fox KVVU. Also in Reno, we will be partnering with the Fox affiliate KRXI as well as NBC. They are both owned by the same broadcast company, Sinclair. On the Hispanic front, in television, we will be working with Univision, Telemundo, and some of the cable networks as well. That is both in the North and the South. One of the key things I'd like to point out is with these buys, if you will, meaning the placements for television spots, is what we call value add. And these are all the additional components to help round out the media buy. In the case of television, we're talking about news program support and opportunities, long-form public service announcements, and it could be in the form of question and answer, vignettes. We have the flexibility to brainstorm and come up and work directly with the stations to develop these. Bonus spots, and the bonus spots mean additional spots in and above what we bought. This will be important too because this creates that extra layer that I was talking about in addition to developing awareness to support the individual events themselves. And then certainly digital and media support. These stations have their own websites and their own Facebook and social media channels, and we'll be able to utilize those to get the word out to an even larger population. And in radio, General Market Las Vegas will be working with various stations, including CBS, Beasley, and Kemp. And Reno area will be Cumulus and Lotus and their various stations among their umbrellas. In the Hispanic radio market in Las Vegas, we'll be partnering with Entravision, Univision, and Lotus. Also Entravision in the Reno area and Radio Tricolor. Again, value add is a key significant piece of the partnerships. In terms of radio, we'll have opportunities for on-air interviews, tables at events that Andres and his staff can attend, live remotes, more bonus spots, PSAs, again, digital support, social media, and possibly some email blast capabilities. Print is another significant component. This is a way, in addition to some of the general mass media, that will be reaching some of these rural and tribal areas. We've partnered with a network of 17 publications, and you can see the list here, but they reach some of these more rural areas such as Ely, Battle Mountain, Pahrump, etc. There will be ongoing print advertising throughout the campaign. In the Hispanic market, we are also engaging print. And in Las Vegas, we'll be working with El Mundo and El Tiempo. In Reno, it'll be Ahora and El Sol. Outdoor is another medium that we intend to use. Outdoor creates a great opportunity to layer and create additional awareness. Generally, you're driving by outdoor boards at a high speed, so there isn't a ton of information, but it's a reminder medium that's important. We're using a combination of both digital boards as well as poster boards. Digitals are the large boards you see mainly on highway areas and commuter arteries. They have the rotating messages and they're in high color. The great thing about digital is that it's easy to update, it can be done so quickly, and that again will help us support some of this layering of the specific events. The posters that we have are more kind of paper posters. They're a little bit smaller board, but they're still significant. But you can find these more in sort of neighborhood, freeway, commuter arteries are more for the digital boards, but these poster boards are more on kind of high traffic streets within these communities. And the great thing about this is we can target, and we are intending to target with the zip codes that we've identified. So these boards will appear in the neighborhoods where we see high concentrations of potential enrollees. Digital media is an important aspect as well. We have various components of digital media. Digital media is a very targeted strategy. Everything we do in digital media runs through an ad server, and that allows us to ensure everything runs. It gives us real-time analytics, so we can see how performance is, and throughout the campaign we can adjust and what we call optimize. So for example, if we see one aspect of digital media not working quite as well as another, we can shift some of those dollars to the one that's performing well, so we can optimize our dollars and get the most out of the money we're spending. That additionally means we have less waste, meaning we're reaching the right people and affecting the message that we need to with them. As we move forward throughout the campaign, we do intend to optimize this and move those dollars where we can get the best bang for our buck. We have several components of digital media that we're going to be using. Retargeting, meaning any visitors that go to Nevada HealthLink website who don't do anything, don't take any action, we'll be able to target them when they leave there and go to other sites with additional ads for our enrollment period, enticing them to come back and take action. Search partners would mean anybody that does a search online, they'll be served up ads if they fit our criteria. Another great thing about digital is it's highly targeted. You can target by various demographics. For example, we're looking at zip codes, age, household income, and we can even drill down so far as to see if they have insurance or if they're underinsured. So we're really able to significantly target people there. Video sites such as YouTube and MaxPoint are important because a lot of our audience are on those kinds of sites. And then we also have an opportunity with the Las Vegas Review-Journal online. This is a fairly new opportunity. We have to run what we call native articles, and that's basically sponsored content that looks like an article that runs in their news feed. Again, this would be a great opportunity to use for some of the specific events that we need to promote. Lastly, I just want to mention we also will be running on Pandora. Pandora is online streaming radio, and Scarborough Research has indicated it does have heavy usage in Nevada, so we feel it's wise to be on there with some messaging as well. Social media is another aspect of marketing, and we have already started on social media, and we will continue to utilize social media. Social media will play a big part in promoting the ongoing events, especially for the brokers. We have been building a follow-up. On Facebook, we have over 1,200 fans. On Twitter, over 1,200 followers as well. We've sent several tweets and posts. We've engaged significant parts of the audience on both mediums. And we will continue to build up those followers so that when we reach out with various events and things of that nature, we're reaching a wider, more significant audience. As we move forward, there are some new opportunities with Instagram advertising that we will look at and see if it makes sense for us to put some dollars there. PR and media relations is in full swing, and Mr. Gilbert alluded to that. He's been spending some time with some of the editorial folks, and will continue to do so. This month is key because we're ramping up for the November 1 kickoff dates and alerting the media, educating them, and bringing them around so that we can have a good turnout both in the north and the south for the November 1st dates. In addition to those events, we will continue to mine into the media relations community, so creating opportunities and taking advantage of opportunities throughout the campaign to create awareness and bring them in, and have them involved. And moving on beyond the kickoff, certainly as I just alluded to, we'll continue to support all the activities that go on throughout the campaign. So we've talked about the sign-up Saturdays and the Tuesday and Thursday pop-up events, the 15th of the month events in December and January, and certainly our closeout events. Those are all key opportunities for media and PR that we intend to play up as much as we can, as well as create new angles and opportunities for more exposure from the media. So before I turn this over to Andres to talk about outreach, I'd be happy to answer any questions anybody might have.
Do we have any questions from north or south? When you talked about posters, is that the same as a billboard?
Technically, it's the same. It's a little bit different size, and the actual material that goes on it is a little different. But from a viewing standpoint, it's pretty much the same thing.
LaWan Lewis for the record, and I just have a question on your general media television. Have you found that the population that you are looking to attract are viewers of the television stations that are primary viewers of the television stations that you are planning to purchase media buys from?
Yes, ma'am. That is exactly why we have partnered with who we have partnered with. Many of the spots will be in various primetime shows. So that was a key indicator as to why we decided to partner with those stations, in addition to the bigger picture of all the value add and who within our target audience that value add can reach as a whole.
If there are no other questions, why don't you go ahead and proceed?
Thank you, Madam Chair. Andres Ramirez for the record. I'm just going to go through a few of the slides, starting off most importantly with the kickoff event we have November 1st. Everyone seems to be excited about what's going to happen on the first day. Our team has been in overdrive both in Reno and in Las Vegas to make sure that we get this event put together in the next few weeks. We've made quite a few strides both in the logistics for where we are with the events and locations. Here, as mentioned, in Las Vegas, we're going to do it at the CSN West Charleston campus. We're very excited about that. Dr. Richards and his administration and the student body have engaged very actively with us, and so they will be sending out communications to their students to make sure that all their students are aware this health fair will be taking place on their campus and encouraging them to attend. We are doing our own promotions and outreach and activities from our side as a working with our existing partners to ensure that we educate as many folks as possible to participate. Similar to what we've done in previous years, we are adding a health fair component to it to offer an opportunity for consumers to learn about the resources they have available in their community. And so right now we're expecting to have about 45 exhibitors participating in the health fair. We have some good partners that we're excited about, including the American Red Cross, who's going to be participating and doing a blood drive. Immunize Nevada is partnering with us, and they're going to be they're working with their partners to offer some flu shots for children who are there at the event. We have 3 Square. We have quite a few of other exhibitors who are going to be participating. So we're excited about the amount of exhibitors that are participating. We've also been recruiting significant volunteers, as we've learned from our previous events that if we don't have enough volunteers to help us manage this event, it can get somewhat out of hand. And so we're getting great response from our volunteer pool that we've used before in the past, of people who've signed up again already to work these events. So we expect to have our logistics in terms of making sure that we have enough tables and chairs and electrical outlets and the Wi-Fi is capable and so forth by the end of next week, so that we can just start doing some testing ourselves. Then we will be doing a training with our exhibitors to ensure that they know what to expect and they have all of their packets, and as well as a training with our volunteers and reaching out to all of the enrollment professionals who will be participating in that process. For Nevada, we have, for Las Vegas, we have up to a capacity of 50 insurance brokers that can participate all at once, so they can be enrolling people. And in Reno, we have up to a capacity of 30 brokers that can participate in that event to enroll folks in our Reno event. So from a kickoff standpoint, we know that it's going to help set the foundation, help generate some media buzz, and just overall help set the tone among consumers for what to expect this year. So we are very focused on ensuring that that event is successful and that we put all the resources we need to put into that. In addition, I do want to say that we have a list of over 200 partners who we've worked with in the past that we are communicating, that we are working with. So they will have flyers and posters about the event at their locations. All those flyers and posters will be delivered by next weekend. And so they'll have a full 2 weeks to be working with consumers in that region of the event to help us with turnout for that. So we're excited about that. And the next page for other events, we have scheduled a December 15th enrollment event. And we are working with the Henderson Convention Center to do an event there. We, from our standpoint, we have not done much work inside the core of Henderson in terms of a large-scale event from an outreach perspective. So we've had good conversations with Henderson and looking at some of the zip codes of where we have people that can enroll. So being the December 15th will be the last deadline that people have to enroll to get insurance coverage by January 1, we want to consider doing a major event on December 15th. We'll also be doing one in Reno. And so we have a few different locations that we have available for that, but we'll be working with our partner groups in the broker community to determine what the best location is for that. Same thing goes for the January 15th deadline. We'll work with our partners in the broker community to determine what they feel is best, whether they want to have it at a broker's office, at multiple broker's offices, or a neutral venue like we've had for the kickoff and the closeout. And then finally, obviously, we'll have our closeout event. And down south, we have made arrangements with the Clark County Government Center. And so we'll have access to their facilities and the pyramid and the amphitheater to be able to do our closeout event there. And we'll be going back to the Boys and Girls Club in Reno for the closeout event in Reno. And the next pages, we have just provided a chronological from to date, from October moving forward, of all of the different events we have reached out to participate and continue to spread the word about the Nevada Health Link and activities that we're doing. We will continue to provide updated events and opportunities at the next board meeting.
Thank you. That is a very exciting report from all three of you. Is there any questions? Questions from the north? Any questions from the south? Lavon? Nothing else? Okay. Well, I would just like to say that watching you since this organization has was conceived and seeing you work, Andre, I have to tell you that you said you're currently in overdrive, but I think one of the things we've all admired about you is always on overdrive for us, that you're always working so hard to get the best results. And I just got to say that I think that these are just starting to lay out so beautifully, not by any accident, but because of your hard work and your past experience in the other events which have become so successful. And the network of 200 partners that you've now developed just really speaks to us on how well you reach out to the community, establish and cultivate and maintain those relationships, and that makes you such a valuable participant for us. And you are so welcome. We thank you. And you know, the participating, I have one question on the enrollment professionals. You mentioned that up in Vegas or South, you'll have about 50 at this first enrollment event, and in Reno about 30. And I was just curious, how is it that you determine, is it the zip code area that you have the event in, about which ones are invited? How do you do that? It's got to be...
How do we determine which enrollment professionals participate?
Yeah.
Oh, it's a combination of things. One, they have to opt in and tell us they want to participate. So we don't know that 50 will say they want to participate. One, the venue that we have, so CSN, we can't accommodate more than 50. So we say that's our cap. We can only have 50. And so primarily it's a first come, first serve. So we work with our broker partners and we ask them during the broker opt-in process, which has been talked about, there's a form and they get to select which events they indicate they would like to participate in. So the kickoff event is one of them. Then we take that list and say, okay, great. Here's how many brokers say they wanted to participate. We're going to accommodate them. If we happen to get more than 50 who say they want to participate in the kickoff event, well, then we'll consider some sort of lottery system, or we'll just have Lydia arm wrestle for the positions. And then we work with our navigator agencies. So let's say, for example, that we only get 35 brokers who opt in. Well, then if we have the capacity, or I should say the demand, that many consumers showed up that we need more people enrolling, then we will rely on the navigators to fill those extra 15 slots to serve for actual enrollment. So we have a full 50 people doing enrollment during the event.
Sounds like a very fair system. Thank you so much.
Thank you.
Any other questions? All right.
Thanks.
Going on.
Thank you, Madam Chair, members of the board. For the record, my name is Aaron Franz, Financial Officer for the Silver State Health Exchange. This is my first time speaking, so I'll introduce myself. For the past 5.5 years, I've served as the Administrative Services Officer for the Department of Business and Industry. I had fiscal oversight over the Division of Industrial Relations, the Division of Insurance, and the Division of Mortgage Lending, and a little-known agency of the Emergency Management Relations Board. I've been through 3 legislative sessions, and I've seen 22 agency-requested budgets through the legislative process. 20 years ago, though my professional career started, I served in the United States Navy, stationed aboard the aircraft carrier USS George Washington. In my 3 years of service, I did 2 6-month deployments into the Persian Gulf. There's again. Let's see. I have my bachelor's degree in business and administration with a concentration in accounting from California State University at Sacramento. I've also completed the Certified Professionals Management Program course here in the state of Nevada. When I'm not wearing my accounting cap, I am a father of 2 and a husband of 1, I guess. Yeah. And when my wife allows me to, I like to take backpacking trips into the Sierras and fish for wild trout. With that said, I'm excited to be your fiscal officer, and I look forward to working with you all. And Madam Chair, I promise you this report won't be as exciting as Mr. Ramirez's, but I will do my best.
Thank you. I'll just be waiting. I want to know if you throw the trout back or not.
Okay. Yes, I've catch and release. So let me preface this by saying the Silver State Health Exchange is fully fee-funded in FY16. We rely on no other monies besides the per member per month fees that we collect from our carriers. Through my predecessor's efficiencies, though we have saved money on our establishment grants, and through their foresight and Bruce's foresight, we decided to repurpose the remaining grant funds for what we would call emergency situations. We don't intend on using these funds only unless we have to. We have worked with CMS to rebudget these monies and also give us a no-cost extension. These grants are scheduled to end December 31st, 2015, but we've asked them to allow us to use the money if need be up until December 30th, 2016. With that, also, and CMS has given us no indication that they are against this plan at all. Matter of fact, they seem to embrace this plan. Not only do we have to ask CMS their permission, we also have to go through our state agencies as well. On October 21st, we have our interim finance committee, where we have 2 work programs scheduled to be heard. These work programs are basically the rebudgeted amounts, and they have to vote on those rebudgets in order for the state to be able to use the federal grant money. So I'll give you the end of the first quarter. The state fiscal year first quarter was done on September 30th. To date, we have collected almost $2 million in PMPM fees, and we've had expenditures totaling about $700,000. We do expect an uptick in the second quarter due to open enrollment. But we are tracking, we are on track to meet our approved budget. So with that, I'll take any questions. Thank you.
And Madam Chair, if I may, I just wanted to add some
Please.
context to some of the remarks by Aaron. As everyone is aware, we transitioned from the Xerox system to healthcare.gov, or the federal platform, in May of 2014 for the opportunity to utilize that going forward. It was a decision made by the board. It was a plan that was well executed and has served us in good stead to this point in time. That being said, everyone is aware, I think, that we are awaiting a proposed rule from CMS and SSHIX, which would indicate to us what the access fee might be for utilizing the federal platform for eligibility determinations and enrollment on a going forward basis. Clearly, that raises a concern for us. The federal marketplace currently charges 3.5% of premium for providing all of the services to the states which take part in the federally facilitated marketplace. We here in Nevada have charged our carriers 3% of premium with the understanding that we can do it without incurring nearly so much expense. But the time has come for them to talk to us about what it will cost for us to utilize their technology. And certainly it begs the question as to how affordable, speaking of affordable care, how affordable that will be for us going forward. That is the rebudgeting that Aaron was talking about. We have roughly $15 or $17 million in remaining grant monies that we do not anticipate using unless required to determine whether there are options available, and I assure you that there are, to our continued use of the federal exchange in the event that the access fee is in an amount that we believe will significantly impair our operations going forward. We've spoken with CMS about this. They understand our concern. They have indicated significant support for us. They have given us at least what I would call preliminary approval in the course of telephone conversations to be able to say, you know, we'll be able to repurpose this money, to rebudget this money, to assure our sustainability into the future. We are hoping that we don't need to do that, that in fact the fee structure that's determined by CMS and SSHIX is something that we will live with. But I will tell you right now, if it's not, we'll find a way to do what we need to do.
Thank you, Mr. Gilbert. I'm sure that may have triggered a few questions. Do we have any questions?
Madam Chair, LaVon Lewis, for the record, I had one question. We were discussing the per member per month payment, and I'm just wondering, what is that currently?
The current payment, the current fee for the exchange, I think is probably the way that I should put it, is 3% of premium for those persons who purchased coverage through the exchange.
LaVon Lewis again. And your concern is that the 3.5% that's currently the fee for accessing the federal exchange may change? Was that what I heard you expressing?
In a manner of speaking, you know, we have not paid them any money to this point, as we have charged 3% of premium as our fee. If they were to come to us and say, for example, and I'm just going to pick a number out of the air, okay, in order for you to continue to have access to healthcare.gov for eligibility determination and enrollments, we need you to pay us 3%. Now, I'm not saying that they would do that. Please don't misunderstand me. But if they were to say that, then we would have to make a reasoned determination, that is the board along with staff, as to whether that is a sustainable amount, given the other the other things which we do. You know, for example, the federal government does not pay for our navigator program. We do that with our fee income. And the federal government does not pay for our marketing program. We do that out of our fee income. And they don't pay for my staff. We do that out of our fee income. We will ultimately, I think, be able to, I'm hopeful to be able to remain on their platform. But if, for example, they were to come to me and say, okay, we need 3%, then I would have to say to them, you know, I just don't think that's going to work out all that well. And at that point, we would be utilizing these grant funds to explore options that are available to us in lieu of paying them 3% of premium. I hope that better explains it.
Based on what you said earlier, though, this is LaVon Lewis again, you have no current indication of what healthcare.gov is considering as a fee to continue to operate on their platform. Is that correct?
Yes, thank you, Ms. Lewis. Bruce Gilbert again for the record. We've had discussions with them on and off for most of my tenure, to be frank, and we have never been given. No one has ever said to us, you know, on the telephone or in the course of a face-to-face meeting, it's going to be X. And the truth is, when they do bring out a rule, assuming it happens in November, it is simply a proposed rule. It's not like it automatically goes into effect. You know, we are not the only state that will be affected by it. It will also impact New Mexico. It will also impact Oregon, because just like us, they utilize the federal platform for eligibility and enrollment. What will happen is a proposed rule will be enunciated. We will have the opportunity to respond to it, as will other states, as will other interested parties. They will sit down and do what Washington does best, I guess, talk to one another and try and figure out where to go from there. But until a final rule takes effect, there is nothing which will permit us to say it will be X amount or it will be Y amount.
Florence Jameson. Mr. Gilbert, this is probably nothing that you can actually speak to, but possibly it was mentioned in the report that we're having generally a positive feeling that CMS will be favorable to allowing us to repurpose our grant funds, our leftover 10 to 15 million you mentioned, into a reserve for emergency, or perhaps to help us reduce the premium, reduce the cost that we will charge on every premium. But it also requires the state legislative committee. And when you meet with the interim legislative committee on this, have you had an opportunity to talk to any of them or the chair and to have any feedback such as CMS gave you that was favorable as to whether they're favorable in allowing us to do this?
Thank you, Madam Chair. Bruce Gilbert for the record. I want to make sure that we understand that I'm not talking about offsetting premium costs, because that is not our request that is before CMS. What we have said to CMS is this: we don't know where you're going to end up in terms of an access fee. However, we have not expended all of our grant monies. And in the event that we determine that the cost of maintaining access to healthcare.gov is not fiscally responsible here in the state of Nevada or for the exchange, we want to repurpose these monies in order to look at alternatives and options that may be available to us. For example, gaining access to Idaho's system, which is a system which exists and was built, or working with Connecticut or California. And that's specifically what we're talking about, is if in our opinion, the boards and staffs, it is not a responsible decision to simply accept what is offered to us, but rather there are less costly options that will allow us to continue to fund our Navigator program at a level that we are comfortable with, or fund our marketing program at a level that we are comfortable with, or, you know, I can't go from 13 to 9 people. I can't do it. All right, I'm just going to tell you, I can't do it. So it's really, it's a maybe. It's literally a maybe. I will tell you that we have had some discussions about the state's interest in making sure that we remain a viable entity. And I know that we will go through the process of talking to the IFC and touch on these concerns. Their concern is a real concern. You know, are we in fact a viable entity on a going forward basis? You know, depending upon what CMS says. And my answer to that is, it doesn't matter what CMS says. They will tell us a number, or they will suggest a number, and we'll say we can afford it or we can't. And if we determine that we cannot, then we will explore the options that are available to us. So, you know, it's normal contingency planning basically for any business. I see everybody shaking their head because anybody who's been in private industry knows that this is how things work. You know, the thing that is most concerning or disconcerting is I get asked a lot of questions. Well, how much, or what do I think? And the truth is, guys, I honestly just don't know. And we're going to have to wait until November or whenever the proposed rule comes out. We're going to have to react to it, and we're going to have to see where it comes out at the end of that process. And based upon that number, whatever happens at the end of the process, we will make a reasoned decision as to the way forward. At least that would be my recommendation. I don't think your microphone is on.
Can you hear me? So, Mr. Gilbert, even if it's to come in November, positive or negative for us,
No, you need.
Yeah. Could you borrow?
we're not hearing you.
Oh, now we hear you.
Okay, now we hear you. I'm sorry. I didn't hear your comment, Madam Chair.
Oh, regardless of how it comes in November, and I know we've all been waiting for this number for a long time, though we're all set and postured, even though we may change our plans later down the line, to continue the open enrollment as scheduled.
Oh, absolutely, Madam Chair.
Yeah.
This wouldn't affect us until 2017.
Correct.
We can't hear you, Madam Chair.
Yeah, I'm sorry. We didn't hear that. Could you just hit the button and say it, and then there. No, it's still not working. Okay, Madam Chair, if you would just push the button and then take your hand off, maybe that will assist. Nope. Nope.
Or you could borrow your neighbor's microphone.
Yeah.
Three times is the charm. Okay, the discussion for possible action regarding dates and times and agenda items for the future. Were there any any items that any of you would like to see added to the agenda in the future?
Continuing discussions on the budget.
Mm-hmm.
Marketing.
Yes. The continued discussion on budget, marketing. Would there be anything else? And the next date for the our board meeting?
Madam Chair.
Yes.
Madam Chair, Valerie Clark, for the record. I'm sorry. I just had one other comment. I would, the contingency planning, I'd love to get more in-depth information on what the contingency plan would be in terms of the systems and infrastructure, you know.
Yes, I think that would be very nice. I know this is the first committee I have chaired, and our original meetings used to last 4 or 5 hours. Now we're down to really short meetings, and today I'm afraid I carried it on a little longer compared to what we've been used to recently. Otherwise, I couldn't have agreed with you more, Valerie. So, Bruce, as things evolve, maybe just even though we're not going to know exactly what's going to happen in November, I know you're constantly, your mind is working, you're meeting with people, you're looking at the Idaho plan, you're looking at this plan. And maybe you'll be able to share with us, as Valerie said, just some of the contingency plans as you find them, the most viable ones.
I will do my best, Madam Chair.
Oh, I understand completely. So any other, I think this time, if there's no further questions, we'll go ahead with public comment. Do we have anyone in the north for public comment?
There is none in the
And
north.
is there anybody here in the south for public, Las Vegas for public comment? Well, that being the case, I would like to adjourn the meeting then. And thank you, everybody, for taking the time to participate. All your comments were so valuable to us today.